Over the years, person-centered care has adapted to the ever-changing system of healthcare to remain current in strategies as a primary approach. Yet, what defines it is withstanding. The definition isn't exclusive to a singular meaning, but rather explored through various overlapping interpretations, each of which intend to provide opportunities for nurses to advance in their field and refine a framework of principles. Typically, person-centered care is based around prioritizing attention towards the patient's personal situation, safeguarding their dignity and developing a foundation of mutual trust and understanding to provide therapeutic care which acknowledges their preferences. Through this, the planning, distribution, and assessment of health can be approached at an individual, collaborative, or organizational level to determine challenges in the cultural and ethical context. A key element in recognizing person-centeredness is the concept of personhood, which delves further into the ethics surrounding nursing. This refers to many things which can be the recognition of the importance of being, such as the status of a person psychologically and physically, what distinguishes humans and other species, or a concept of morality that links with autonomy, independence, and agency. Healthcare upholds the meaning that centers on values, attitudes, and connectedness. However, it is interchangeable and can include aspects of legality and philosophy to provide depth or clarity on what is expected from personhood. With this term in mind, person-centered care can closer be defined as the focus on recognition, respect, and trust between the healthcare provider and the individual to achieve therapeutic benefits in a safe environment, free of bias and judgment of the individual's personal situation or identity. In striving for person-centered care, the skills and capabilities of the registered nurse must be in alignment with the key elements of this care. Professional competency and the knowledge, experience, and ability in their required skills are highly critical in providing medical care and health solutions that are personalized to the patient. Interpersonal skills that are highly developed do not simply build rapport, but engage the patients in conversation that collaboratively problem solves, creating a much deeper impact. An RN's commitment to a job exudes a sense of dedication and a wanting to work with the patients and their family in providing the best care. Similarly, the clarity of beliefs and values and knowing self enables the RN to understand the commitment and meaning they place on various tasks. Even if a team working with a patient are all different or differ in values or beliefs, if a shared common goal is set to be met, then a high challenge, high support networking environment can be formed, providing the best care and outcome for the patient. However, this sense of knowing self does not come easily. Through lifelong reflection, the acceptance of feedback, and the setting goals within the SMART framework, this can be worked towards and improved over time. In 2013, a Swedish university hospital conducted a study of 20 registered nurses to establish the facilitating factors that contribute to effective inclusion of a patient in deciding aspects of their care. Effective communication techniques, including silence, humor, open and closed questioning techniques, were used in conjunction with active listening to empower and engage patients in their care. However, this was not simply done, as some power over the situation had to be relinquished by the RN to ensure person-centered care was maintained and the focus on their needs was paramount in their interactions and care plan. There are many challenges that face an RN in the workplace, and many are constantly occurring. Every situation is different and therefore requires a new approach and leadership strategy. Challenges often arise when at least one of the 5 practices of exemplary leadership aren't utilised to their fullest potential. These include modelling the way, inspiring a shared vision, challenging the process, enabling others to act, and encouraging the heart. When none of these 5 practices of leadership are applied, patient-centered care becomes less effective due to a lack of responsibility. Being professionally competent requires a high level of commitment to both the patient and practicing nursing care at a high standard. Leadership comes in many forms and is often challenging. For example, in order for a workplace to constantly keep patients involved and informed in their own treatment, nurses have to lead their patients in giving necessary information, rather than just informing medical staff of their existing problem, making them feel more in control of their healthcare. Another leadership challenge constantly faced by nurses is their ability to hold firmly to their beliefs and values. If a RN is able to overcome an obstacle whilst holding on to their beliefs and values, it shows everyone around them that it doesn't matter what the obstacle is, their beliefs and values are what they hold closest and can be applied to resolve any situation. A good example of healthcare practice innovation for the purpose of incorporating patient-centered care at the level of prerequisites of healthcare professionals can be found in this case study of 2 aged care facilities in Ireland. 2 separate residential facilities took part in the research. The researchers engaged the staff in brainstorming and reflective sessions to understand the facility's culture at the start and end of the experiment. We will explain how one was more successful than the other for reasons pertaining to our outlined prerequisites. The 2 facilities were operating on different levels of professional competence throughout the study. The facility that adopted a shared narrative that focused on person-centered care was able to enhance their hands-on nursing care with an overarching view to collaborate when confronted with conflict. The other facility failed to communicate openly about conflict, and this impacted upon their patient care. The prerequisite of developing interpersonal skills was met by the staff in a few different ways. Communication problems, such as not acknowledging the resident when entering their room and not fostering an environment in which residents could share their personal or sensitive issues with staff, was identified. The facility that had a manager who wanted to change for the purposes of person-centered care thrived, while the facility who had a manager with a fixed mindset did not. This demonstrates the importance of commitment to the job. Knowing self was important to the initiative because of the constant self-reflection required in the numerous reflective workshops. The staff were regularly having to think about their own actions and the actions of others and how they impacted upon the residents. Clarifying beliefs and values was at the forefront of this initiative. The teams that believed residents deserved privacy and dignity put these values at the forefront of their practice and were more successful in their communication with residents and other staff. The main outcome of this initiative related to professional prerequisites was the development of a narrative or a sense of working together towards a common ideal with shared beliefs and values. In conclusion, we hope that this presentation has been informative in explaining the prerequisites of nurses and how they are linked to person-centered care. The prerequisites, when put into practice, achieve great outcomes for patients and continuous personal development for nurses.